Hello, good day and welcome to Nuwa TV. And this is Dr. Zaman Wabani coming to you again from a beautiful Nuwa world. And today we'll be talking about a topic close to my heart, painful sex and its management and the revisitation of the champion vagina. Today I'm going to be introducing to you MonaLisa Touch. Alright, so as a urogynecologist, the vagina is dear to my heart and close to my hands. That's the face that I see. So we deal with vagina all day long, and most importantly, I am very much interested in the sexual health of my patients, because that's what's living all about if we only just draw breath. So with menopause that I discussed in my previous series, part of what the menopausal woman deals with is painful sex. This will develop with time because if untreated, the vaginal atrophy, colloquially referred to as vaginal dryness, which is the thinning out of the vaginal and vulval skin from a stacked coin stratified squamous epithelium to almost a simple epithelium that is not able to take the insult of the friction of sex. That happens with menopause a lot and with the aging woman. And hitherto, all we needed or we had was to replenish what is lost through the use of the vaginal cream. But as I've seen in my 30 years of practice, no woman has been able to stay compliant with using the vaginal estrogen cream forever, as it's needed for its maintained action on the cells of the vagina and the vulva, and hence it doesn't really work so well. In comes MonaLisa Touch. A little history about this amazing technology and machine. It was actually developed initially to bring back life to the breast cancer survivor. So hello, I want to hail out to any of the person watching this movie who has passed through breast cancer and is living to tell the tale. You're a champion already in your own accord. But yet, you draw breath. But I also want you to live life. So you can identify with what I'm about to say that 90% of breast cancers in the female, especially if it occurs in the menstrual ages or in the young menopausal female, is estrogen positive. And if it's estrogen positive, your gynae-onc might have treated you or your breast cancer surgery, and your radiation oncologist might be giving you anti-estrogen medication. And they don't want estrogen within a 10 miles click of you. Well, yes, I'm happy. They're keeping you alive. But what next? That estrogen that they don't want around you means that they will, in addition, not only take out your ovaries if you still have a functional one, that means your breast cancer occurred in your menstrual years, but they will also put you on an anti-estrogenic medication for upwards of 5 to 10 years. In as much as that keeps the breast cancer away and stays in remission, it does a havoc to your external genitalia and your internal gynecological organs. What does it do to you? It actually catapults your vagina from a 30, 40, or 50-year-olds to an 80, 90-year-olds. Because with the extreme extraction of all forms of estrogen from your body, the vagina essentially shrivels up. It thins out so fast that sex feels like knives going in through you. Your partner wouldn't want to hurt you. You don't fantasize about it anymore because it's only linked with pain, and the relationship takes a strain. We understand that intimacy is a core part of any healthy relationship. And should you have the beautiful fortune of having survived breast cancer in your youth, in your 30s, 40s, or 50s, you probably have a husband as in a similar age. And hello, he's still very, very, very sexual. So the question is, what do we do? Prior to MonaLisa Touch, we just gave you creams, the lubricants, coconut oil, name it, Vaseline, whatever we could. But that didn't help. You all always came to see me with what I call survivor's guilt. Yes, you draw breath. Yes, you're living. But are you really living? You are afraid you will lose your relationships. You will lose your husbands. They might go out. You don't know what to do. Well, a set of physiotherapists in 2015, actually much earlier than that, in the UK, developed this machine out of the need, as they've seen it works well on the face in revitalizing the face. So they applied the same technology to a machine for the vagina, and in came the first carbon dioxide fractionated ablasive laser therapy for the vagina. And the first modular one was MonaLisa Touch. What does it do? A 5 minutes non-painless treatment will inflict microscopic injuries to your vaginal cells that will cause the cells to tell the body that they've been injured, so bring more blood supply and heal us. That process alone will cause the cells to get robust again, stack up again, and the pain will disappear. It is fractionated, so it's done in 3 steps. Level 1 is done the first day, level 2 comes in 6 weeks after, and you finish level 3 3 weeks after, when the entire width of the vaginal epithelium and lining is treated. With this procedure, the vagina takes a heave of relief. Sex becomes comfortable again. Your bladders do well, hence this procedure is also used to treat recurrent urinary tract infections. The urethra does well and the spasms stop, and you get back your gynecological life. And then you come back once a year to have your booster, because it's been estimated that in about a year, all the treated cells would have been shed, and the new oncoming cells not treated might begin to exhibit the same symptoms again. As we speak, we have more than 1 million women in the Tri-County area that are benefiting from this procedure, because we have extrapolated it not just to the young breast cancer survivor, but to every postmenopausal woman in her 60s, 70s, or 80s that is experiencing this problem, albeit naturally. And should anybody that is a female gender live longer on this earth, they will at some point experience it. And if it's important to them to keep their sexual relationship alive, especially if they have partners to do so, this is a no-brainer. So with the MonaLisa Touch, I unleash the champion vagina once more. And nobody, and I mean nobody, should again live and bear the discomfort of painful sex. Plus, if you're having recurrent UTIs, that's gonna treat it. If you're having lichen sclerosis of the vulva, that's gonna treat it. If you're having dysplastic syndromes of your vulva, that's gonna treat it. Vulval cancer occurs with age, that's gonna prevent it. If you have anal tags, anal lesions, mild cases of fecal incontinence, this laser therapy is really the right pixie dust for you. With a 5 minutes procedure, bringing back life to the entire pelvis of the woman, we can't go wrong with it. So come in today and ask us about MonaLisa Touch, and I'll be excited to get you your champion vagina back. Thank you, and have a lovely day. Bye-bye.